Hi everybody, how are you? I think you are doing great. Or some of you may be not doing great. I'm Dr. Shariful Halim. I passed MBBS from Dhaka Medical College Hospital in 2014 and I did complete my internship just a few days ago, and I am here to give you some tips about the surgery part of the final professional exam. I think I have had some bad experiences with surgery. I think most of our friends did have some bad experience in surgery, and most of those people, especially my juniors, I mean, they are very tense about it. So I think it's my responsibility, or I feel responsible to give you some advice about surgery. So I think my advice may help you. I mean, may help you to get better in surgery. Okay. So first of all, why is surgery so important, or why it's hard? Surgery syllabus is big, you know. There are multiple parts in surgery. Multiple parts, I mean, the general surgery is a big one, the systemic surgeries, so many subdivisions, so many specialties. So it's a big part, it's a big burden. And also, the surgery, academic activities that go on in surgery department are not well coordinated. I mean, you don't miss a lot of lectures. You go to the lecture, you go to the wards, and you don't find a teacher or a mentor, and you feel horrible. I mean, they won't teach you anything. I mean, they will teach you something, but they will ask you everything. I mean, in the exam, they want you to know everything, but they don't teach you everything. So you have to take the responsibility yourself. I mean, you have to learn things by yourself. So it's your responsibility to plan and to act on, to master yourself in surgery. So what you can do is follow my guide, and that will help you. So first of all, let's divide the surgery examination. So in the final prof, you have the written part, you already know it, and the viva part. And in the viva part, there is a board viva, and also you have short cases and long cases. And this is the most feared part actually, as I think, or my experience says so. So the long cases and short cases, especially the short cases, I mean, people fear this a lot. I mean, this is the horrible part. People always be tensed about it. So let's talk about it first. So for the short cases, you have first to select the short cases that you need to master. And I think there is actually two broad class of short cases. First is the lump, and next is the ulcer. So you have two broad classes. So I myself had a case of lump in final professional exam, which was a thyroglosal cyst. So this is not a very common case, but it can be present in your final professional examination. So the lumps are like thyroid lumps, the lipomas, the dermoid cyst, the sebaceous cyst, or maybe lumps in the immunocerebral region due to hernia, maybe an indirect hernia, maybe a direct hernia, or a lump in the testis. I mean, you can have a case of hydrocele. And other cases, the groups I already mentioned, the ulcers. So I had a case of squamous cell carcinoma. So malignant ulcer can be given in the exam. The other non-malignant ulcers that can be also given in the exam are the ulcer in the diabetic foot, or ulcer due to peripheral vascular disease. So those are the most common short cases that you need to master. So you have to practice a lot. So it is an old saying that practice makes even better, or practice actually makes even perfect. I think this thing or this regime has changed. Now the modern concept says that perfect practice makes even perfect. So not only practice, you have to practice it perfectly. So that's why you need some guidance. You need some good books, good resources. So the books that I followed is the book written by Dr. Noor Hussain Shahin, who is actually an assistant professor in the Chittagong Medical College Hospital. His book name is Secrets, a book of clinical surgery. That's a great book, very succinct, very short, but very informative at the same time. But some of my friends say this book is very short, so feel uncomfortable or feel this is not enough. So they also used Makhanlal. I also read it. So what I felt about Makhanlal is it has some things that are beyond our capacities, but it's still a very good book. So you can use Secrets and the Makhanlal for the short cases. And for the practice, I myself made a video about ulcer, which is on my YouTube channel. You can see that. And also, I'm planning to make other videos about the lumps, especially the inguinoscrotal swellings, I mean the hernias and the hydrocele. And also I will cover other lumps if I can. So that's about the short cases. And about the long cases, you have actually 2 or 3 systems that they cover in the long cases. So most common long cases come from the hepatobiliary system. I mean the chronic cystitis is a very common case, and obstructive jaundice. I myself did a case of obstructive jaundice. It was due to carcinoma of the hydropancreas. And other system is GIT, so we can have stomach cases like carcinoma of stomach causing gastric obstruction, or pyloric stenosis causing gastric obstruction due to chronic duodenal ulcer. And next cases are the malignant cases from the GIT, starting from the cecum up to the rectum. So you can have a lump in the abdomen, which can be anywhere. So according to the site, you have to tell the provisional and differentials. Like if it's in the inguinal region, especially in the right inguinal region, it will be carcinoma cecum, or maybe ileocecal TB, or maybe appendicular lump. And be aware about the carcinoma rectum, especially whenever a case of carcinoma rectum is given, people feel very uncomfortable, because for that case to be diagnosed or examined, the most important examination part is you have to do a DRE. And I think most of the people, especially girls and also boys, feels very uncomfortable, very uncomfortable about doing a DRE. Actually, some other cases like carcinoma prostate or the benign prostate hyperplasia also requires essential examination, which is a DRE. So please try or practice DRE. What is the proper position of doing DRE, and what are the common findings that you can get in those cases, I mean the CR rectum, carcinoma prostate, or BPH in case of DRE. So also try to master the findings. So that's very important. That's simple, that's so simple, but at the same time it's very important. So those are about the long cases, but some uncommon long cases can come. I mean, we had a case of carcinoma of breast and also a case of Bardet disease as long case. So you see, Bardet disease can come as a short case, or it can be a long case. So please read a lot about Bardet disease. It's a very common case. And about the board viva, if you cover the cases well, I mean, if you cover or if you study or master the short cases and long cases, the board viva becomes easier, because a lot of things they ask in the board viva are related to the cases. And other parts, if you do the written, if you prepare yourself for the written well, I mean, how can you prepare well? You have to collect a question bank and solve it. I mean, you have to solve the last 7 or 8 years question which came in Dhaka University. And please, if you can, make a note, because a note helps always. So if you can solve all the questions, especially the books that can help you in solving the questions are Bailey Labs, you already know, and also the SRB. I think this is a very good book. This has all the questions answered, all the answers of all the questions actually that have been in the last 5 or 6 years, or maybe the last 7 or 8 years. It has all the answers. So you have to solve the questions from SRB and also take helps from the Bailey Lab. And in some cases, secrets also help, because in the secrets book there is a case portion and there is a viva portion, and that viva portion will help you not only in viva but also in written, because it has a lot of information which is very important and it is presented in a very well manner. So I think this advice will help you, and please give time to surgery. I think this is the most important part of your examination. If you can master it, you will pass the final professional exam, and I hope you will be a good doctor. Bye bye. See you next time.